we are looking at the psychiatric disorders and the commonly used drugs, drug of choice. So firstly, we are looking at the trigeminal neuralgia. So just to brief up, what we are looking at is trigeminal neuralgia. We'll be looking at the restless leg syndrome. In case of psychosis, the ADHD along with the Tourette syndrome as well. And in case of family abuse with the drugs, and in case of tics with the Tourette syndrome. So now to begin with, we are looking at the trigeminal neuralgia. So here the DOC is the carbamazepine. Next we look at the RLD, restless leg syndrome, that is the post-herpetic neuralgia. So in these cases the DOC is the GABA, gabapentin as well as the pregabalin. So here just add up the mechanism of action being it binds to the alpha 2 and the subunit, and this is of the presynaptic calcium channels. Next we move on to the, in case of psychosis, what is a DOC? It is the atypical antipsychotics. Then moving on to the resistant psychosis. So in case of resistant psychosis, the drug of choice is the clozapine. Now in case of ADHD, attention deficit hyperactive disorder, so here there is the methylphenidate which is used. So only the drawback, so the adverse effect you can say in this is it worsens the tics as well as the abuse potential. Next we look at the ADHD, and this is along with the Tourette syndrome. So in just of ADHD we use methylphenidate, whereas here in case of Tourette syndrome we use the clonidine. Next we look at the ADHD and with the family history of the drug abuse. So here the DOC is nothing but the atomoxetine as well as the viloxazine, and the mechanism of action being it is a selective NER reuptake inhibitor, that is SNRI. And lastly we look at the tics associated with the Tourette syndrome. So here the drug of choice is nothing but the tetrabenazine.